Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and this is Cardiology Lecture Series. And all our programs are video streamed through YouTube. And please do subscribe to our YouTube channel. Now, the feature presentation. Hello, ladies and gentlemen. I am Dr. NIK NIKAM, and today we are going to look at peripheral arterial disease, or PAD 2016 guidelines. A lot has been written about new guidelines for peripheral arterial disease, but for practicing primary care doctor, a specialist, or an endovascular specialist, here is the summary of the 2016 changes. If we are dealing with a patient who is 65 years or older, if we are dealing with patients with a history of hypertension, diabetes, or history of hyperlipidemia, or history of smoking, more than ever we need to routinely screen these patients for peripheral arterial disease. Specifically, we need to ask for symptoms like leg pain, cramps, wrist pains, skin discoloration, or difficulty in walking. It is very important to understand that only 10 to 15% of the patients with significant peripheral arterial disease have symptoms. By the time they get symptoms, the disease may be far advanced than what we think it may be. Hence, it is very important to do screening tests on all these patients who are at high risk for developing peripheral arterial disease. Even those patients with history of coronary artery disease or carotid artery disease, they all need to be screened for peripheral arterial disease. When these patients come to the office for evaluation, either at a primary doctor's office or in a specialist office, it is imperative that we examine the patient's legs thoroughly. Look for evidence of poor circulation in terms of diminished pulses, absent pulses, or skin ulcerations. After the examination, if there is evidence for decreased circulation, the simplest test we can do in the office is the ankle brachial index, and this should be routinely done in patients who are high risk, such as those who have diabetes, hypertension, hyperlipidemia, history of smoking, age over 65, and those who have history of a coronary artery disease. The normal ankle brachial index is 1.0 to 1.40, and we see this higher number more so in patients with sclerotic arteries which are non-compressible. The results are borderline if the ratio is 0.91 to 0.99. If the ratio is less than 0.9, that is indicative of peripheral arterial disease involving the lower extremities. If the ABI is abnormal, then we can proceed to a simple non-invasive study, which is the duplex scan of the arterial system in both lower extremities and look for any evidence of significant obstruction. This can be confirmed using CT angiography or MR angiogram, and if there is a critical stenosis that needs intervention, then we can proceed with angiogram and peripheral vascular intervention if it is needed. Now let's look at some of the management recommendations from the 2016 Peripheral Arterial Disease Guidelines. It has been emphasized significantly that there should be education of the public and also the medical professionals, especially the primary care doctors and specialists, to understand the significance of peripheral arterial disease in these high risk group of patients. This can be in the form of lectures to primary care doctors, internists, and specialists like cardiologists and endovascular surgeons, and to public in forms of public education. The most important thing is to strongly advise smoking cessation. Even people who are exposed to second-hand smoke should be advised to avoid smoke inhalation at any cost, because smoking can greatly aggravate the peripheral arterial disease. According to the 2016 guidelines, all these patients need to be treated with antiplatelet agents, starting with aspirin 81 to 325 milligrams and clopidogrel if there is significant peripheral arterial disease. If these patients undergo vascular intervention, they need to be on dual antiplatelet agents. Definitely, these patients need to be on lipid lowering drugs. They should be strongly advised to go through a smoking cessation program. These high-risk patients should also be getting influenza vaccination to prevent any cardiovascular problems that can aggravate or make things worse as far as the peripheral arterial disease is concerned. Celestazol has been shown to improve symptoms in patients with the peripheral arterial disease, even though it does not do anything to the underlying atherosclerotic changes in the peripheral arterial system. However, celestazol should be avoided in patients with congestive heart failure. If the patient has significant stenosis, a critical stenosis in a segment of a peripheral artery, then they should be considered for endovascular approach, which involves catheterization and placement of a stent, especially if the patient has symptoms of gangrene or pre-gangrene. If there is significant obstruction, the other option that is available is peripheral arterial revascularization by a vascular surgeon. And the most significant recommendation in the 2016 PDA guidelines is a supervised exercise program. This is a symptom limited exercise program which is to gradually help these patients to increase their walking distance. Hopefully, by increasing their walking distance both in duration and in intensity, would improve the collateral circulation and thus help to minimize the symptoms. These patients are also recommended to have upper limb exercises to improve the circulation, and they all need to be followed periodically to see how they are making progress in terms of their exercise improvement. This is in a nutshell the PAD guidelines 2016 update. I hope this has been useful to you. These are all things that we routinely do, but it is extremely important to first look for patients with peripheral arterial disease, especially in the high-risk population, and take these proactive steps so that we can minimize the symptoms and also improve patients' quality of life and reduce the risk of ischemic events. Thank you so much. I am Dr. NIK NIKAM. Thank you so much for watching our program, and please do subscribe to our YouTube channel. Again, thank you so much for watching this presentation, and until next time, I am Dr. NIK NIKAM.